welcome to this special episode on laparoscopic surgery, and with me in the studio is Dr. Bhavesh Patel. He has done his MBBS from the Rajiv Gandhi University and went on to do his MS in general surgery from Rajasthan, and then went further on to study laparoscopic surgery from the World Laparoscopic Hospital in Gurugram. He has been a practicing laparoscopic surgeon for the last 6 years and is currently associated with RG hospitals in Goa. Dr. Bhavesh, welcome to the show.
Hi, Dr. Steffi.
So, Dr. Bhavesh, what is laparoscopic surgery all about?
Laparoscopic surgery is a minimal invasive technique which uses a specialized instrument, and through small cuts, surgery is performed.
Right. So, minimal means the incision is on a smaller incision compared to
very few and small incisions compared to traditional surgeries.
So, even the instruments used are different from traditional surgeries?
Yes, instruments are totally different from traditional surgeries.
So, doctor, would you like to highlight what would be the difference between laparoscopic and traditional surgery?
By laparoscopy, there are few scar and less pain, early recovery.
Right.
And by open technique, there are bigger scar, more blood loss, more pain, and longer time for recovery.
Yes. Doctor, what would be the benefits of laparoscopic surgery over traditional surgery?
Less pain, early recovery.
So less pain means you mean to say that the pain during surgery as well as the post-surgery pain?
Post-surgery, there is very less pain as compared to open surgery.
To open surgeries. And with regards to the scar, as in the length of the scar will be lesser compared to traditional surgery?
Yes. There are 2 to 3 small cuts.
Okay.
2 to 3 small cuts in a different area of the abdomen.
Right. So, doctor, which are the areas which you can perform laparoscopy surgery in? Is it every surgery that is in open or traditional way can be done in laparoscopic, or there is just scope for a few surgeries to be done laparoscopically?
A few surgeries are still performed by traditional methods, but majority of the cases are done laparoscopically.
So, doctor, which are the cases you would like to elaborate, which are done, laparoscopically and are more preferred to be done laparoscopically than traditionally?
Generally, I deal with gall bladder, appendix, different types of hernia,
right,
and other types of intestinal disease are done by laparoscopically.
Right. So, doctor, you mentioned gall bladder. So, what is the function of the gall bladder? We'll start with a very basic thing so that our viewers understand what is the gall bladder first. Then we'll go to the disease part of it. So, what exactly is the gall bladder or the functions of the gall bladder in the human body?
Gall bladder is an organ which lie beneath the liver, and it is connected with liver and our small intestine, right, through bile ducts.
Yes.
And the liver juice which forms into the liver, it goes to the gallbladder, and then gallbladder stores it, and whenever there is a person's digestive system requires the bile, so it is released from the secreted from the gallbladder, and it reaches to the intestine, and it gets mixed with our food.
So basically its function is to help in digestion of the food. So what are the diseases that could affect the gallbladder?
So it's the most common disease is formation of gallstone in the gallbladder, by which patient's digestive system gets hampered, affected.
So doctor, is there different types of gallstones that are there, or is always the same type of gallstones that are formed in every patient?
Generally, 2 types of gallstones are there: pigmented gallstones and cholesterol gallstones.
Right.
Pigmented gallstones, it occurs due to there may be some blood disorder, and cholesterol stones form because of a high cholesterol diet.
Basically, a high fatty diet.
High fatty diet, yes.
Right. So, doctor, in case of gallstones, if a patient does develop gallstones, what would be the symptoms that we would present with? I mean, anybody could have gallstones, right? So, what would be the symptoms we would experience if we have gallstones?
There will be acidity, indigestion, bloating, constipation, right upper abdominal pain, nausea, vomiting.
Yes, and this would happen often because, as you said, acidity, bloating is something that commonly also happens to us. If we eat something spicy or if we eat very oily food or we skip meals, we do get acidity and bloating, but that would be a one-time happening. So in case of gallstones, is it something that happens frequently, or it's just a one-time episode?
No, in gallstone disease, these symptoms occurs frequently and in a multiple episodes. Yeah.
So does the patient also experience pain along with these symptoms, or it's just bloating and nausea?
Depends on the patient's disease stage and symptoms. It varies.
And the type of gallstones.
And the type of gallstones.
Right.
It varies to person.
Right. Doctor, when would you perform gallstone surgery? Like, do all gallstones require to be surgically removed, or is there a conservative management to it?
When a person presents to us with a silent gallstone findings and person is not having major symptoms or repeated episodes of indigestions. So
basically, when the symptoms are uncontrollable.
Yes, when the symptoms are uncontrollable, so at that time we advise patient to undergo surgery.
So gallbladder surgery is called as cholecystectomy, like you said. Is there any effects on lifestyle post gallbladder surgery? As in, does the removal of a gallbladder affect your life in any ways?
No, there is no major concerns in patients after post surgery. After surgery, initially for a few weeks, patient has to just take care of diet, and then later on, patient's body will get into normal digestive pattern.
So basically, although the gallbladder, like you said, has the function of secreting the bile juice and helping in digestion, removal of the gallbladder doesn't affect digestion in any way.
No, it doesn't affect.
If you weigh the options, having a gallbladder with multiple gallstones and not doing anything about it is worse than having a gallbladder removed.
Carrying gallstones is worse than removal of the gallbladder.
Yeah, because it would lead to
complications. And many patients presents with severe complications also. There will be a severe pus collection or severe lump formation to the gallbladder, or there might be perforations of a gallbladder also, or there might be impaction of the stone in the gallbladder and gallbladder duct.
So if you weigh the outcomes of both, I think not removing your gallbladder with gallstones would have severe impact on your lifestyle than not having a gallbladder. Right. Doctor, now moving on to the next set of surgeries that you could perform laparoscopically, you said hernias. So what is hernia? What kind of disease is a hernia?
Hernia is a defect in the abdominal wall or groin area because of weak musculature of the particular area of the body, and there will be a bulging of the abdominal contents through that defect which cause hernia.
Doctor, what are the common sites of hernia to develop in the human body?
Common sites of hernia usually occurs at navel region, groin region, flank region, or any person who has underwent a previous abdominal surgery by a traditional method. Even hernia occurs at previous surgical site area also.
Okay. So doctor, would you like to tell our viewers why hernia develops in the, like you said, navel region or in the thigh or groin region? Is there a particular reason behind it because of the anatomical area over there?
Men tends to have hernia more than females because men usually are involved in heavy weightlifting professions or performing
heavy
work.
Right. And so they are more prone to inguinal hernia.
Navel hernia.
So what would be the reason why they develop inguinal hernia? Is it because of the musculature in the inguinal region?
Weak musculature.
Doctor, is there an option for conservative management in hernia, or is surgery the only approach in the treatment of hernia?
Conservative management is not an option for hernia disease. Surgery is the gold standard treatment for hernia.
Right. So there is no option of,
There is no
of not getting operated.
not getting operated or by any other means of treatment will help to reduce hernia. Surgery is the only option.
Is the only option. So doctor says, suppose the patient doesn't, take the surgery option, what would be the complications he would suffer from because of the hernia?
The contents will get obstructed, strangulated, and which can cause complications which leads to a life-threatening condition.
Right.
And
so that could lead to more problems than
problems,
having the hernia
yes.
removed. Right. Doctor, moving on, you spoke about appendix and the treatment of laparoscopic surgery in appendicitis. So would you like to enlighten our viewers what exactly is the appendix? What is the function of appendix in the human body?
Appendix is a small tubular structure. It lies at the area, at the junction of small and large intestine, and sometimes a food particle or some kind of bacteria can get entrapped into the appendix, and which leads to inflammation of the appendix, and it causes appendicitis.
So in a patient presenting with appendicitis, what would be the commonest symptoms a patient would present with?
Common symptoms are right lower abdominal pain, severe to moderate pain, fever, constipation, bloating, nausea, vomiting, urinary discomfort are the major symptoms which occurs in appendicitis.
Right. So doctor, in appendicitis, what would be your surgical approach in the treatment of appendicitis?
Many patients has to undergo appendixectomy surgery because conservative management does not always help to treat appendicitis.
Right. So it's always a laparoscopic surgery that you would do, or would there be instances where you would also perform open surgery in case of appendicitis?
Majority of the cases in appendicitis are deal with laparoscopy surgery. And very few cases in which laparoscopy is contraindicated. So those cases are operated by a open surgery method.
Right. So doctor, I have a doubt. Is again in the treatment of appendicitis, appendicectomy only the only option, or is there also conservative management in case of appendicitis?
Conservative management depends on the patient's comorbid conditions, and surgery is always recommended in case of appendicitis, and so early surgery is recommended to prevent further complications.
Doctor, I would like to ask you, how would you repair a hernia laparoscopically? I mean, is there, just elaborate the steps that you would do.
So usually in laparoscopy method, contents of the hernia are first reduced from the musculature defect, and by safeguarding the vital structures and surrounding structures, and flaps are raised, and the musculature defect is closed, and a specialized mesh is placed, and it is fixed with tackers.
So basically the mesh prevents the the organs or whatever the musculature was bulging out to come back again in the bulge.
Yes, there will be a
that creates like a barrier.
Yeah, approximation of the muscular defect is closed, and that mesh will act as a barrier for a future recurrence, to avoid future recurrence
of the hernia.
Right.
And doctor, would you like to talk about the different types of mesh that they use in hernia? Is it the same for every hernia, or is it
it varies
in different types of hernias?
It varies for depends on the types of hernia. For a navel hernia, there is a different mesh. For a groin hernia, there is a different mesh. And for a flank hernia or a recurrent hernia, there is a different mesh. There are 2D mesh, 3D mesh, 4D mesh.
Right, interesting. So doctor, as we come to an end of today's episode, what would be your take-home message to our viewers on laparoscopic surgery?
Laparoscopic surgery generally leads to faster recovery, shorter hospital stay, less pain, and less scar.
Right. Dr. Bhavesh, thank you so much for giving our viewers so much information about laparoscopic surgery and its outcomes, and how to handle various conditions like appendicitis, gallbladder stones, hernias, and I'm sure they will be more forthcoming in seeking treatments in these conditions. Thank you for watching. Stay safe, take care, and keep watching Prudent.